Well, Baltimore County has also made modifications for stage 1 of reopening, and joining us with more on his plan is Baltimore County Executive Johnny Olszewski. Good morning. Thank you for joining us.
Good morning, Jennifer. Thanks so much for having us on today.
Can you explain a little bit about why you made the decisions that you made concerning stage 1?
Yeah, I mean, we are at a partial opening. It's in response to the governor's directive that left local governments to respond to his changes. As he pointed out, there are 4 jurisdictions that account for 72% of all the cases across the state of Maryland. Baltimore City and Baltimore County are among those 4. And so we, knowing that there are not the testing needs, there's not the PPE, there's not the sufficient contact tracing that every health expert has said needs to be in place to safely reopen, we knew that we needed to talk to our health experts and economic development experts and try to balance, but first and foremost, putting the safety and health and lives of our people above. So we were only able to take some steps towards reopening, but not all the steps outlined by the governor.
So I'm hearing from a lot of business owners right now who are feeling punished, and they feel like, that there's really the haves and the have-nots when it comes to being able to reopen, and they're worried about their customers going to the counties that are open to get services like their hair done or to go ahead and buy flowers, for instance.
Yeah, and I think this is part of why the actions are really problematic. This is exactly at odds with what the governor just a few weeks ago had said was the right strategy. 3 weeks ago, he was saying that there shouldn't be a regional plan, that this should be a statewide, because exactly what he had said might happen is in fact happening. And I think what we're going to see is in several weeks, we will probably see large spikes in cases and unfortunately in deaths as a result. I certainly hope that's not the case, but I think it's very likely that we will. Other countries that have opened the doors too soon have seen the need to close down again and go backwards. Dr. Fauci has warned that premature reopening will lead to significant problems. And Dr. Inglesby from Johns Hopkins, who actually serves on the governor's task force on reopening, our recommendations in Baltimore County are almost exactly aligned with what he said in terms of a safe next step and responsible given where we are with the current conditions on the ground.
Well, I don't think anybody wants to see another death related to the coronavirus, but when the stay-at-home order was put into effect, it was to slow the spread and make sure that the hospitals had the capacity to take care of the patients and so they wouldn't be flooded. And now that the governor is saying all of that is in place, I think a lot of people are feeling like the rug was taken out from underneath them when they heard that the stay-at-home had been lifted and that places could open to 50% capacity. And now you're saying no. So people would like to know when they can see their businesses be able to reopen.
Well, certainly hospital capacity was a critical condition, and we worked closely with the state as we continue to do, as well as our local hospitals, and we feel like we are in a good place on hospital capacity. But the governor also rightly pointed out the need to have robust testing, contact tracing, and PPE, all of which we're still seeing significant problems with. And we're left in Baltimore County, for example, trying to find additional test capacity. Those 500,000 tests that we lauded when the governor announced they came in from South Korea. We have yet to get even a plan for distribution, even though we've asked several times for that. We have not really seen them significantly put into production. We are standing up our own contact tracing in addition to what the state is doing. And because we still have needs on things like PPE in some of our hardest hit places like nursing homes, we're now in the county looking to step forward and lead the way because we haven't seen enough from the national and state government. Those are other critical conditions to make sure we can safely reopen. So we are there on hospital surge capacity, which we applaud and we're grateful for. But we have said clearly we need to do more on testing, contact tracing, and PPE to make sure we can get there the rest of the way. And trust me, no one wants to open up more than I do. So we are working around the clock to make sure we have those other conditions in place. And if we have to do it locally, we will. We want our businesses to be open in Baltimore County.
All right, County Executive Johnny Olszewski, thank you so much for joining us this morning.
Stay safe. Thanks again.
All right, you stay safe as well.